Good evening, everyone. Thanks so much for coming to our presentation today. We thought it would be a great chance to interact with you all as you're getting ready to complete your training and education for this journey that you're on right now and entering the last part of the scholars program. We thought it'd be great to have a presentation about ways that you can leverage your experience that you've had as a scholar. So we're going to have Dr. Amy Paul, who is a geriatrician and also our Director of Data and Impact, to talk a little bit about her experience coming out of medical school and maybe some pointers for you all as you move forward. And then we have Miss Olivette Burroughs here, and she's going to talk about loan repayment programs through the state of Virginia. So without further ado, here is Amy, Dr. Amy Paul.
Hey everybody, I'm just gonna start sharing my screen. Hope you can see it. So thanks for coming, and I hope the information will be very useful to all of you. If you have any questions, of course, feel free to ask. So just a little bit about me. So as Amy mentioned, I am interesting. We're both Amy and Amy. I am a geriatrician, so I completed my basic training all over the place. I have never been an AHEC scholar. I wish that was something that I had the opportunity to participate in. But I kind of did it in the roundabout way on my own through my school. And I started my internal medicine training in New York, and I finished with my geriatrics fellowship that I completed between Florida and Ohio. It was very rewarding, as you can imagine, learning about patients from all over. So I've met patients from all over the world and seen the health system in different countries. So that has also always been something that I valued. And I can see from the AHEC experience, you get the opportunity to not only meet migrants and figure out what happens with migrant care, you get to figure out what happens with, a rural patient who's lived in their environment forever versus somebody who came from somebody else and been a rural patient. So you do get the flavor of meeting people where they are, and then seeing what it's like to practice medicine or even physical therapy or even start thinking about nursing in an environment where it's multidisciplinary, right? There may just be one dentist for the entire county, but you still have to work with them and the limited resources that you have. Okay, so what we're going to talk about today is how do you reflect this experience in the way you present yourself, especially for you guys who are graduating. So what do I do with these 2 years I just had? What does that mean? What's the value for me as I look forward in my continued training? If you're doing a fellowship or residency, or if you're now going into the working world, how do you present yourself on paper, which is the first place everybody's going to meet you? So I have a couple of slides here. I'm going to talk more than present. So this guy is like how you were. Everybody's looking, what direction should I go in? I'm not really sure. So you have all chosen a health profession of some sort. So thank you very much. We all need healthcare. The question now is, so why AHEC? Like, why did I do AHEC? And you have had the opportunity to network with different people, to get different skills, and it makes you a more valuable candidate for a job, especially when you start thinking about going to a rural environment. I can tell you that rural medicine is the way of the future, even if it doesn't look like that now. If you look at money moves like Walmart now offering healthcare to their people, and if you think about where are the majority of the Walmart stores, they're in rural places. They're in places where it may be a big city, but what's there is a large sprawling Walmart. That is what's available. If you start looking at the way Congress and all the bills are being written, or even the way the venture capitalists are investing into medicine, it is always to provide like telecare, telemedicine. People are thinking about, well, how do we present internet to people to start offering medical care? And whether that may be telehealth or having just a specialist who visits every now and then to see patients. It is the way of the future, and what AHEC is doing is building up the workforce to be able to support that. That wasn't true before. Before, it was everybody was centered around academic institutions and thinking about urban care and that's where the wealth is and that's where we're going. But in conjunction with COVID, people have realized that that is not necessarily the best way to practice or what is needed the most. So let's talk about this guy who's not an actual AHEC scholar. I just couldn't get permission from the student to get his picture. So this is just an example because we all like cases of a student who came into AHEC in his second year of medicine. And he worked with his center director, visited a lot, saw a lot of patients, completed all his didactics like you guys have. But he networked enough to find himself in a position to pick up a job at that center director's institution. And he's worked with them for several years, and now he is on the board of one of their community healthcare organizations, having a pretty significant impact on the community that he serves. So that is sort of the way we're trying to nudge you guys into not necessarily being on a board and serving prominently in a community, but starting to see and think about the ways that you can, follow a career where you give back to these communities where people don't have as much or are underserved or are in need of people with your sort of expertise. So one of the benefits of being an AHEC scholar is that you already have the exposure. So you guys have had a unique experience where we have trained you in how to think about cultural competency or how to think about interdisciplinary care when you start serving in these communities. The difference between, and I'm sure some of you have seen this, the difference between working at VCU, if you've been there, or an FQHC or in a rural clinic is that you find different specialists, yes, but everybody's walking down the same road. We're under-resourced, our patients need us, and we feel really good about just taking care of the people that we serve. I'm not saying that's not true for everywhere else. It's just that rural medicine has a special, I don't know, type of heart to it that you don't necessarily find in a busier, more structured environment. The next one is that you get the hands-on experiences. If any of you have been, and I think Stacy's on the call to RAM Clinic, that is something that not every student like you receives. It is unique to find students in that environment who are serving alongside mentors and preceptors and, in a large scale where you have all these people who need you. They really do need you. That is unique, okay? And then the third one that I believe is most important is that you start building your network of mentors and friends and peers. And you now have a center director that you can call and say, hey, Miss So-and-so, I'm thinking about a job in XYZ. Would it be possible for you to connect me with somebody I can speak to? Or even just tapping into their wisdom of the students they've met and where they see students go, okay? So that's one way to start thinking about it beyond just, I came for 2 years. Yes, I got my stipend. Yes, I did all this work. But how can you use that to make sure that you are supported as you go through the rest of your training, or even how you start thinking about, well, I don't want to do fellowship because I don't have to. So what about a job? Another benefit that's not on here is that you actually put yourself at an advantage for negotiating, whether it be salary or time. So let's say you're thinking about going to Southwest Virginia, right? It may not be where you're from, but there's a really interesting job there. You like the salary or not. You like that you can work part-time. You like that it's close to the mountains because you love to do the mountains and you like to be there. And as Miss Olivette will tell us soon, you start thinking about, well, loan repayment, right? You're in a better position to approach an employer and say, listen, I understand your patients. I understand their needs. I've worked alongside them. I have worked in this center before. I would like to negotiate my salary with you, or I would like to negotiate my time, or even the environment that I work with, because you already know what it is like to work for an FQHC, for example, but you also know that they do need you, right? So a lot of students do not think about rural medicine because it's not something they get exposed to, A, and B, people have, we all have this idea in our brains that the rural environment, it's just a lot of grass and there's nothing happening and the people don't like me or I don't like them. But until you meet them, or if any of you have been to the RAM clinic and you've been energized by such an experience, you can talk about that in interviews. You can talk about that in your essays. You can talk about that when you do get a contract to negotiate and say, but listen, I've had this experience. I know this community and I want to serve. Okay. So this young lady sitting in her interview, she is feeling fantastic. She knows exactly what the employer needs. She's been there, she's seen it, and she has a resume that demonstrates her experience. One thing I know most health profession students are afraid to talk about or may not have the opportunity to do is frame your experience in a way that helps you stand out from the crowd. All right. So AHEC Scholar is a beautiful thing to have on your resume, especially if the employers that you're approaching or even people that you're approaching for further training understand the model. But it also speaks not just of your compassion, but your own love for healthcare and serving people. All right. I love when I've read essays or even when I've interviewed physicians and they start talking about their experiences. I love it, especially when people can communicate what they've learned from this experience. For example, when I was a medical student, one of the first traumas I saw was this man on a motorcycle who was driving without a jacket. And of course, if anybody can imagine, I'm not going to explain it. It was really terrible. I learned that I'm never going to ride with a motorcycle for the rest of my life. Right. It's always nice to have a story, specific examples. I went to the RAM clinic and this is what I learned. I had the opportunity to go to a vaccine clinic and I was able to talk to migrant children from halfway across the world. And I leveraged my knowledge of cultural competency when I spoke to them, communicated with them, made them more comfortable. It demonstrates to employers or even, people that you're trying to network with that you don't just think about medicine as blood pressure, physical therapy moves, or things like that. You bring the soft skills that people like. You're empathetic, you can talk to people, and you understand what, particular populations of people need. You also will talk about how did AHEC overall influence your career goals? So I did this AHEC scholarship. Yes, I got a stipend. Yes, I got some training. But you know what? It really made me think that I would like to have a life of service. At least start my career off in an area where people really need me, and it's not necessarily I'm going to somewhere to work because there's an abundance of resources and all these things happening. Okay. There's a few states that have started actually being very intentional about residencies and fellowships that are in rural environments. If any of you are applying for any of those or you have the opportunity to work in those sorts of environments, you are already one leg up because you've learned half the stuff already, right? So you understand that when you see a woman in a rural environment, you are now the OBGYN, you are now her dentist, you are now the person who's her cardiologist, and you know how to tie that all together using your interprofessional education training, using your cultural competency, just how you talk to her, how do you ask the questions, okay? So how else can you be involved with AHEC? So like I said, you're building skills, you're networking. I gave you tips on how to do your resume, start thinking about negotiating. We also have workshops like these that you can participate in. There's the opportunity to volunteer and keep volunteering. Example, RAM Clinic, hint, hint. And being a mentor to other students coming up behind you, okay? And then we have this AHEC ambassadorship. If any of you have heard about it or are eligible for it, you now have the chance to talk to students who may not even know about AHEC overall and talk, just communicate with them. What has your experience been like? What does it mean to be an AHEC scholar? I know a top question is, how did you manage the 40 hours of didactic on top of this and on top of that? How do I do it? I don't understand, right? Because we all are paving the way for those behind us. So you get an opportunity to do that as well. So I appreciate your listening. Does anybody have any questions about anything that I just said or anything else you'd like to know? Any questions at all?
Where'd she go?
Can't see it.
You can also put your questions in the chat if
Yeah.
you are feeling shy.
I have a question. How well
Yeah.
known is AHEC Scholar Program outside of Virginia State?
Yeah, that is a good question. So AHEC there's an AHEC in every single state except one. We recently went to an AHEC conference. It was busy. There were maybe like 600 people participating. So every state has an AHEC, and the students do a lot of things, just like you guys have. Everybody has the 40 hours of didactic, 40 hours of clinical, and then the opportunity to participate in workshops like these. Some students even write papers. They present at conferences and things like that because the focus is on rural care. So just rural medicine on its own. Is that helpful? There's also a national AHEC organization, if you want to just Google National AHEC organization, where they kind of bring together all the AHECs around the country for mentorship to the staff, helping the students, even providing webinars and things to AHEC scholars nationwide.
I actually had an administrator contact me like a few days ago, and she came from Arkansas, and she was administrator for like a long-term care facility here. She was looking for some continuing education opportunities for her staff, and she said, I just found the AHEC information and contacted you because that's what we do in Arkansas. So it's pretty well known. I think this year, we're trying some new things to help you guys feel a little bit more plugged in with the state office. That's where me and Dr. Amy work, but also to help you understand that this is a national experience that you can take throughout. We'd like you to stay in Virginia and practice, of course, but it's definitely well known throughout the country as well.
Absolutely. Good question.
And we do have one question in the chat. How do you become an ambassador?
Okay, so you need to contact your center director and ask them for an application, and you just complete an application, turn it in, and your center director is supposed to review applications. We can have up to 4 per region this year, and the requirements are that you participate in at least 4 outreach events per semester. And then once you do that, you turn in like a little sheet that you get signed off that says you participated in those events. And those could be anything from helping go out to schools to talk about health careers, to helping your AHEC recruit your next cohort of AHEC scholars, go into a classroom, talk about it for a little bit. That can count as an activity. But the stipend payment is $600 per semester. So definitely ask your scholar coordinator or center director how you can get involved in that way. We'd love to have you all be engaged with that. Are there any other questions? Yeah, it's a great question. Well, if we don't have any other questions, we'll move over to Ms. Olivette Burroughs, and she is with the Virginia Department of Health, and she's a statewide health workforce manager, and she manages Virginia's loan repayment programs, which are huge that's probably amongst many other things that she does in that state role for the state of Virginia. But I asked her to come on and give a little overview of the loan repayment program.
Hi, good afternoon or good evening, I should say. Thank you so much, Amy, for inviting me. Am I allowed to share? I believe I can. Let me just.
There you go.
Okay, super. Can you all see my screen well? Can you hear me well?
Yes.
Perfect. Thank you so much for the introduction again, and thank you for inviting me. Again, my name is Olivette Burroughs, and I'm the statewide health workforce manager at the Virginia Department of Health. I manage 15 and growing incentive programs. So today our focus will be the state loan repayment program. But if you have questions about any of the programs, I'd be happy to answer your questions and provide any information that could be helpful for you. So the purpose of our programs, really all of our programs are to improve and increase access to quality care. And how do we do this? We place providers like yourselves in health professional shortage areas. So you are key in helping fill those important roles in Virginia in those rural and underserved areas. So again, thank you for being in those professions and just your interest in working and being in Virginia. So currently, the state loan repayment program is our focus today. It requires what we consider a community match. In prior years, and you may have heard this, the community, meaning your employer or someone else, would have to provide a community match for you. But right now, the Commonwealth of Virginia is doing this. So when you do apply, you don't have to worry about a match. So the Commonwealth of Virginia will take care of that for you. You don't have to come up with anything. So regarding the fair distribution of funds, there's an advisory committee that oversees all of the selections for the program, just to ensure that everyone gets credit. And in our advisory committee, I'm not sure if any of you know this, actually give credit to AHEC scholars. So you start off, I think, with 5 or 10 extra points when you do apply for our program. I'm sure you're excited to hear that. If you have any questions throughout the presentation, please feel free to ask. And we can also have a question, an opportunity for questions at the end. So how much money do we have? So currently we have $822,000 from the federal grant, and we have $1.5 million from the General Assembly, and we have up to $1 million from the Tobacco Commission. And we'll talk a little bit more about how that works. So you have to work at an eligible site in Virginia, and that site must be located in a health professional shortage area. It must be nonprofit, a state or public facility, or if it is for profit, it has to be operated by a nonprofit. And of course, we need an eligible applicant. So how much can a person get? If you have the loans, you can get up to $100,000 for a 2-year award. And we can provide renewals of up to $40,000 per year for individual renewal. So for the first 2 years, your obligation would be up to $100,000 for 2 years. And for the renewal 3rd or 4th year individually, it's up to $40,000. The application cycle, it's January 1st through March 31st of each year. I provided the link to our website, which may change. So please, we do have an online portal that might change, so make sure you go directly to this link that I'll share with you. But currently our application cycle will be 100% online. So who's eligible? So we have specific providers who are eligible for this program. So physicians are eligible, nurse practitioners, including nurse midwives, physician assistants, dental professionals, and that's the dentist as well as the registered dental hygienist, mental health professionals, and if you are an alcohol and an abuse counselor, it has to be at the master's level. Registered nurses, including certified nurse midwives, are eligible. Pharmacists are also eligible for the program. What is key to remember when you seek a job in a health professional shortage area? When you consider your specialty, it must be a primary care specialty. So primary care specialty essentially includes pediatric, geriatric, psychiatry, family, internal medicine, women's health, adult care, and I believe I've listed all of them. Yes, so these are the primary care disciplines that we consider for the program. So who's eligible? So you definitely have to meet certain requirements, and I will go through some of the main requirements that you want to consider prior to applying to the program, and also as you look to get a job in a rural underserved area. So you definitely must be a US citizen or a US national. You must have completed all of your residency training if it applies, or if there's some sort of board eligibility or certification associated with your specialty, that must be completed, or you must be eligible. You must have graduated from an accredited program and must not have any restrictions on your license. You must also satisfy any type of contractual service obligation. So for example, if your employer says you can come and work for me for 2 years and I can pay off 20% of your student debt. So that would be considered an obligation, and you would have to complete that before you're eligible for our program. So whether the obligation is federal or state, your employer, any type of entity, you must be completely finished. And that also includes any of our programs as well at VDH. So you must not have any type of federal or state obligations, any type of judgment liens. I like to give the example of child support. I think very early on, we had somebody who didn't share with us that they owed child support, and the state took their entire check of $20,000, and they had to figure out a way to show us proof of debt reduction. So please be mindful of that. So you must agree to practice either full-time or half-time. So half-time, I highlighted it in green because it is a new requirement for actually started last year and this year. You must again be full-time and work at an approved practice site, and full-time means 40 hours per week for a minimum of 45 weeks per year. And if you have any type of administrative duties assigned to your job or your role, it cannot be more than 8 hours. So again, these are direct patient care jobs that are eligible for the program. And again, if you work half-time, it's very similar, 20 hours per week, not to exceed 39 hours per week. And as far as administrative duties, no more than 4 hours. You must have an employment contract or offer letter at the time of application. So that means if you're speaking to one of the rural or underserved areas, and they really like you, but you haven't fully started yet, you're still eligible as long as you have that legal document to say that you will start at a later date. You certainly must agree to use the loan repayment funds to repay your student debt, because we will ask for proof of debt reduction. So I mentioned the Tobacco Commission earlier. There are funds set aside for those who live and work in the tobacco region, all of the regions, and that's South Side and Southwest, and that excludes Roanoke and Lynchburg. Again, you must live and work in the tobacco region to be able to get their funds. And you must also meet the SLURP requirements, and your loans cannot exceed any award amounts that you receive. So just breaking down the awards a little more, because I know a lot of times we have questions about that. You cannot receive more than $140,000 for all 4 years. So if you decide to apply for the first 2 years and then a third and a fourth year, it cannot exceed $140,000. So for the first year, you can get $100,000. So 50 will come from the Commonwealth of Virginia, and 50,000 will come from the federal funds. In the third year, you can get up to 40,000. Again, assuming you don't get the max for the first year, you can get the third and the fourth year individually. So 20 from the community, 20 from the federal, until you meet your $140,000 required maximum. So it's the same for the tobacco region funds that I shared earlier. It's the same maximum, and they've added an additional criteria that you have to meet. You cannot receive more than 50% of your student loan balance in loan repayment. So that's something to consider when you apply as well. And it's the same amounts, except there's no match for the tobacco fund. So if you are awarded $100,000, everything will come from the tobacco funds, and the same for the third and the fourth year individually. So I know I talked about health professional shortage area. You might want to know, how can I find it? I've provided a link that we will share. We'll share the presentation with you. But in order to find if your site is located in a health professional shortage area, you can click on this link and type in the address of the practice site that you're interested in or you'll be working at. And the example where I showed the arrow here is pointing to primary care, and it's yes. So if you're a mental health provider, it will say mental health. If you're a dental provider, it will say dental here, and it will give you the information, including your score, your site is designated, your ID, and information about the site. We also have 3rnet.org, kind of our career connector. So when providers look for job, we send them to register at 3rnet.org. And when facilities look for providers like yourself, we have them register there. So we connect you with jobs in rural and underserved areas at 3rnet.org. And this is my contact information. I would, Amy, if it's okay with you, open up the floor for questions.
Absolutely. And Abby's going to field the chat for any questions you want to put in the chat, or you can unmute and ask questions directly.
Thank you.
And I've shared your links in the chat as well. I'll send them your email address as well.
Thank you. Any questions? How are you guys? Where are you in your education? Or are you thinking of rural and underserved areas? Why or why not?
I have a question.
Sure, thank
So
you.
I see that there's a SLURP program and there's a tobacco commission. Is it like I see that it's like the same thing, but tobacco commission is like an additive on top of SLURP, or is it just the same thing that you have to have you have to satisfy both criteria of living in a tobacco commission counties or places, or is it like a So is it like an added addition to a SLURP program?
Yes, perfect. It is an extension to the state loan repayment program. You have to meet the same requirements and live and work in a tobacco region to receive their funds.
So if you live in a tobacco commission county, you get a little bit of monetary bonus on top of SLURP.
Actually, it's either or, so it's essentially the same program. You can get federal funds and state funds, or you can get the tobacco funds. So you don't get both, you just get one.
Thank you.
You're welcome. Any additional questions?
I guess I have a question. When would you say, and maybe you don't know, but when typically are people applying for this? Are they doing it straight out of their programs, or are they waiting a couple of years, or I'm just curious.
So great question. So I've had a range of when individuals apply. Many folks whose employers, so I have a lot of employers who use this as a recruiting tool. So I'll see a lot of new grads applying to the program, but I've seen folks who've been out of school for 5, 10, 15, 20 years applying to the program. So there's no limitation to that. But I've seen a lot of new grads, especially with the employers who are actively recruiting and using our program as a tool.
Yeah, I can imagine it would be pretty attractive if, you're thinking like, maybe I want to buy a house and I've got all this other debt going on and thinking about it, and you're looking for new employment. It kind of matches up to make that happen, but it's also good to think about as you're stepping out into the workforce as well.
No, absolutely. And you make a great point, because we had a success story from one of our providers, and she shared with us that before she received the loan repayment, she had to choose between paying her rent and taking care of her family. And so with the loan repayment, kind of easing that burden for her, it made it a lot easier for her and her family, to live a better life. So you can look at it at different angles of how it can impact your life, but a lot of people don't think about how it can impact their families. You're making an impact, in the community, but it can also impact your life and your family, not just reduce your debt and you move on, right? It's actually making an impact.
Absolutely.
I have a question as well, Olivette. Thanks for coming. Do you know how long it takes for the students to hear back, or the professionals to hear back after they apply?
So great question. So typically for this program specifically, because the application cycle is January through March of each year, the advisory committee meets in April. So once they meet in April, we will share selection information and notify candidates of eligibility.
Nice, thank you.
I have
You're
a
welcome.
question.
Yes, go ahead.
Thank you for that information. I see that you oversee a lot of programs that I want to read about, obviously. But do all the programs require you to be a graduate at a specific level, or is like each program different based on like the program requirements?
No, absolutely. Great question. So some of the programs, so our loan repayment programs require you to complete your education and receive your license and all of that. But if you are a nursing student, and you're interested in, again, working in Virginia, this ties back to all working in Virginia, and you're currently in school in Virginia, you can get scholarships while you're in school. Do you have a specific discipline that you're interested in?
So I'm actually a double major, but I'm focusing on the when I'll be done, when I graduate, I'll be a LCSW.
Okay,
So
perfect.
more the mental health aspect, but I want to work for the Virginia Department of Health. So that's why I'm a public health double major, because I'm kind of like tied between both. But I also have, I enjoy working with the incarcerated population, which is definitely a population that needs a lot of people. So I'm like this kind of like bit of a light bulb, because I'm sure there are a lot of jobs that or programs that will work with the Department of Corrections, because that's what I wanted to do when I finish my career.
Yeah, so one thing that you want to keep in mind, and thank you for sharing that, is to be eligible for these programs, you have to be providing direct patient care. So when you say you're interested in VDH and public health, or do you plan to be an administrator or a leader, as opposed to providing direct patient care? So it makes a difference in receiving student loan repayment. And we also have a behavioral health loan repayment that's very similar to the state loan repayment program. The main difference, it's all state funds. It's a state program, and it's a different application cycle, but most of the eligibility is the same.
Thank you.
You're welcome. Any other questions? You guys have some great questions. Thank you.
I don't see any other questions in the chat. And I don't hear anybody interrupting me if they have any other questions. I just want to thank both of our speakers, Dr. Amy Paul and Ms. Olivette. Oh, I always wanted to call you Olivette Burroughs, for coming and talking with us tonight. I've put their information in the chat so you can be in touch with them, as they're now a part of your network of people that have resources and things to share with you. And we appreciate your time tonight and hope to see you again soon. So thank you so much.